Tatiana, I'm a student physical therapist, and today we're going to learn how to assess mental function. The video before was an example of an indication why a patient may need a mental function exam because he was confused and disoriented. So let's learn how to do it. Mentalization contributes to the patient's impaired overall functioning. We should assess the patient's mental function before they participate in physical therapy. Assessing mental function is made up of the patient's level of arousal, attention, orientation, cognition, and memory. Arousal is defined by the level of consciousness. There are 5 levels of arousal: alert, lethargic, obtunded, stupor, and coma. The patient here is awake and interacts to normal stimulation, so she is considered to be alert. A lethargic patient may have difficulty focusing and may fall asleep if they are not being stimulated. An obtunded patient is difficult to arouse and usually confused when they wake up. Patient needs repeated stimulus to maintain consciousness, and interactions will most likely be very unproductive. A stupor patient responds to noxious stimuli and returns unconscious when stimuli stops. In this example, the student physical therapist is using a sternal rub as the noxious stimuli. The patient is unable to interact with the PT. A coma patient cannot be aroused by any stimuli and is unable to interact. Attention is the patient's self-awareness of the environment or to the task without being distracted. To test this, we ask the patient to repeat items on a challenging list or spell words backwards. Make sure words or numbers do not have a relationship with each other so the patient is recalling instead of guessing. Okay, I'm going to ask you to repeat 3 words back to me, okay? The words are bird, car, and house.
Bird, car, house.
Here's a tip. Ask the patient to remember the same 3 words later so you can test their short-term memory. I'm going to ask you to repeat those to me again a little bit later, okay? Orientation is the patient's awareness of person, place, time, and circumstance. Make sure to use we instead of do you know when asking the patient questions. Okay, what's your name?
Matthew Lucena.
Okay, and where are we right now?
The playground.
Okay, and why are we here?
Because I ran into a tree.
And then what day of the week is it?
It's Friday.
Cognition is the process of knowing that includes awareness and judgment. For this, we test the patient's fund of knowledge, which is just questions that the general population would be able to answer, calculation ability, which starts simple and then progress, and proverb interpretation, which is testing the patient's ability to use words outside the original meaning. Who is the current president of the United States?
Abraham Lincoln.
And then what's 1 plus 1?
24.
What about 2 times 3?
16.
And then 16 divided by 4?
27.
Okay, and then what does the phrase "to kill 2 birds with 1 stone" mean to you?
To complete 2 things at the same time.
Memory can be broken down into short-term and long-term memory. Short-term memory is the retention of events or learning that is within a few minutes, hours, or days. And then long-term memory is events or experiences over a period of years. To test long-term memory, you will need information from the patient's chart, like where they were born. Tell me the 3 words that I asked you to recall earlier.
Bird, car, house.
Okay, and then where were you born?
I think I'm from Narnia. I think I'm gonna go now.
Sir? Remember not to lead on the patient with the answers to your question. Try not to relate your questions to each other. We don't want the patient to guess a certain pattern, like for calculation ability, all the problems be answered in 2. And give the patient time to answer. Do not let the patient know that they answered the questions wrong. And also understand your patient's education level to gear your questions based off of that. We would document like this for the patient shown earlier. The A stands for alert and the O for orientation. The patient was unable to recall place, so we put that in the parentheses with the amount that he got right. The patient's attention and short-term memory was intact, so we noted it there. And the patient's cognition was also impaired because he was unable to perform calculation or funds of knowledge. So we wrote 1 out of 3 in parentheses. The patient's long-term memory was also impaired.